My name is Peter McNaney and I have the privilege to be the chair of Belfast Health Trust. So I'd like to take a minute or two of your time to talk about the Trust annual report. I have now been chair of the Trust for the last 16 months and it has been a terrific privilege to gain an insight into the work that happens across a very large and complex organisation. But there is one constant that I have come across, and that is the professionalism, care, dedication and compassion shown by all the staff of the Trust. It is really uplifting to witness firsthand the dedication that people show to their patients, the fact that they put the patients at the centre of their care, and the fact that they are completely and utterly committed to doing what they can to improve the quality of those patients' lives. So what I want to do today is I want to talk about some of the highlights of the Trust annual report. Firstly, a word about resources. Of course, resources are tight, and we must all be conscious of the fact that we need to make as much of the resources available to us as we can. But it is also important to point out that this Trust has an annual budget of £1.1 billion, and that is an extraordinarily significant amount which can and should make a real difference to people's lives. So I think we should concentrate on a conversation on what we have and how we ensure that what we have goes as long a way as we can make it. I'd like now to draw to your attention some excellent areas of good practice which are highlighted in the annual report. Firstly, I'd like to mention the support package that our intensive care team has developed for families of patients who have died in our intensive care unit. I understand that relatives and families have been particularly appreciative of the time taken to remember their loved ones and to acknowledge their loss. This model has been adopted by the Trust's Bereavement Forum and will be rolled out as good practice across all areas of the Trust. I'd also like to highlight the work being done to help older people to remain supported in their own homes, providing where necessary an appropriate alternative to going to hospital. A dedicated consultant-led multidisciplinary team now provides rapid assessment and intervention for those elderly most in need. I'd also like to talk about our continued drive towards providing a completely smoke-free environment for everyone. We really want to live the advice we give our patients and clients. Whilst our buildings have been smoke-free since 2007, the annual report contains an important update on where we are in our journey towards a completely smoke-free status throughout all our sites. The resettlement team provides long-term psychiatric patients on their journey from hospital to community settings, facilitating rehabilitation for patients whose needs are best met with more intensive support than would be available through mainstream adult mental health service. And finally, I mustn't forget Daisy, the safety and quality cow, who has developed quite a following in the Children's Hospital and is providing a branded focus to all safety and quality initiatives being taken forward in the Children's Hospital. I am a great supporter of Daisy. I regularly visit to see what clothes she's wearing, whether it be for Halloween, Christmas or Easter. I think she's a terrific initiative, super fun, but absolutely focusing all of us on the critical issues of safety and quality. I really welcome the opportunity to talk to you about the annual report. I hope that some of you will look at it and read it and appreciate all the really fantastic work that is being done for patients and clients across the Trust by dedicated, compassionate and caring staff. Thank you very much.